0.02.
Wow. So almost.
No, he's
where needs
19 years later. I would
Perfect.
say most probably he's home free.
Great.
Doing great. Good quality of life. Fully active. Doing
Sure.
all the things he wants to do.
Wonderful.
So it was really pleasing to see someone 19 years after treatment in remission. And that's the usual.
Yeah.
Actually, the majority, 90% of our patients are home free with prostate cancer when we use brachytherapy and a short course of radiation called radiosurgery. And they do better. They do better than with surgery. The main competing method of treatment is open surgery.
Yeah.
And unfortunately, most men choose or kind of maybe push to have surgery. About 60% of men in America with prostate cancer choose to have surgery or led that way. And there's this big idea that if you have robotic, have you heard about robotic surgery?
Yeah, I can't tell you much about it, but
So there's
the
these
name sounds familiar.
machines, and the idea of the machines are they have lenses and magnifying glasses and clips, and your hands are outside the body, but they run mechanical hands inside the body to do the cutting and the pulling and the
Right.
snipping, and you're supposed to be able to see more and therefore get better results because you don't hurt or cut the nerves.
Right.
So there was a study that was done and published in Cancer. So Cancer is one of the major journals, and another study in the Journal of Clinical Oncology that really looked at quality of life issues after robotic surgery versus open surgery. Open surgery is like you'd imagine. The doctor puts an incision in the
Right.
patient, and he physically with his hands cuts and removes the prostate.
More of a traditional approach to treatment. Is
Correct.
that correct? Okay.
And the prostate is located between the bladder and the rectum. So the bladder's just in front, the rectum's behind, and the prostate's in between, and the nerves are on either side. So it's like filleting the fish a little bit. So what's better when you compare the two? And having this $3 million machine with lights and mechanical hands and lenses, or the doctor?
Right. It's a good question.
It's a good question.
I'm
It's a good
I'm
question.
thinking I want to try to answer it.
Okay, we don't have to answer it. Okay, so
tell us about it.
So they analyzed men who had open surgery and men who had robotic surgery. So continence means can you control your urine? So that's what urinary continence or continence. So they had 220 men who had the open procedure. What percent of the men had normal continence after open surgery?
40%.
Yeah, you're pretty good. Actually, it's 19%. So
Okay.
it means that 80% of men were affected one way or another with continence after having open surgery.
Gotcha.
So it's a lot.
Yeah, there's a lot.
And what percent had normal continence after robotic? The robotic is the $3 million machine, the mechanical hands.
22%.
Well, you're pretty good. You're going in the right direction. 13% were normal.
Well, okay.
So it means that 87% were adversely affected by having robotic surgery on the control of their urine. And remember, the whole idea of the machine is to try to get better results.
Sure. And in theory, it's actually less.
So it's less good results. And people are shocked whenever I show men this data, because a lot of men are out there saying, wow, if I can only cut out my prostate, I'll be home free, which is another discussion we'll have in about 2 minutes. Now, the sexual function. Remember, this machine is supposed to be able to see the nerves so they can avoid cutting the nerves, and you can keep your sexual function and normal erections. So if you have open surgery, what men had no problem? Open surgery, no problem with sexual function after surgery.
15%.
Well, you're getting better and better.
Getting better. Okay.
2.9%.
2.9. We're dropping here. Okay, 2.9.
2.9% had no problem.
No problem.
Which means that 97% of men had some problem with sexual function after surgery. Now, remember, hospitals are spending $3 million on this machine to get better results. So if you have this machine helping, what's the likelihood of having normal sexual function after surgery with the machine for prostate cancer?
With the likelihood of having good function?
Normal
function.
These are men. The average man with prostate cancer is probably 65 years old. So they're telling you what's the likelihood of being normal after robotic surgery for prostate cancer?
32%.
2.3%.
Okay.
Meaning 98% of men
Wow.
are having some damage to their sexual function with robotic surgery. And the sad thing is, many men don't understand that it's going to hurt them so much.
Yeah, sure.
So you can see that the majority of men, the vast majority of men, have damage to sexual function and urinary function after surgery. And then you say, well, okay, that's okay if it cures me, right? Maybe.
Right.
Maybe,
I mean, yeah.
maybe.
Depends on the patient, but
Okay, so then if you go to one of the biggest urologists in New York, a big hospital, and published data, look at his published data versus our published data, and let's just say you have a PSA. PSA is that prostatic-specific antigen. If it's initially 4 to 10, and that's a big category because usually over 4 men get a biopsy.
Mm-hmm.
So if your PSA is 4 to 10 when you're diagnosed, and you have surgery by this very famous doctor, the success rate 5 years later being cancer-free is 76%.
okay.
Okay, so a quarter of the men have had recurrences within 5 years.
Right.
And that's a big thing because a lot of men are led to believe that if you cut out the prostate, you're going to be home free.
Right, yeah, sure.
And obviously you're not home free. A quarter of the men have had recurrences. Now, those same men came to us, and we've treated thousands of men with prostate brachytherapy and focused beam radiation, short course. The success rate is 90%. So instead of 76% with surgery and the complications, we're talking about 90%, which is 18% better results.
Yep.
And 18%, there's 200,000 men with prostate cancer a year, so you're talking about 36,000 lives potentially saved.
Yeah.
So you're talking about huge differences. You're talking about the ability to avoid radical surgery. You're talking about better quality of life. Men can work every day during our treatment. There's no hospital stay or anesthesia or cutting or bleeding. So it's interesting, this patient stimulating this conversation about robotic surgery. Is it better? Well, it doesn't look to be better. It doesn't even look to be better than open surgery.
Right, yeah.
And it seems like the surgeon, even though he tries to cut out the whole prostate, can't cure the men like we are able to do.
Right.
So it's certainly something to think about. And I always show men this data when they come in because we've got a book. That data I'm quoting from is page 8 of our prostate book. And again, you can call and ask for the prostate booklet, and we'll send that in a DVD to you if you want. Or you can call and ask your questions during the week in our office. Our office is 212-CHOICES, 212-CHOICES. So we're going to go to our sponsor. Our sponsor has this incredible voice, and I would like our
Might
listeners...
sound familiar, Doc. Is that correct?
It's really beautiful. We're going to go for a few minutes to this voice, and then we'll be back with some other cases.
Looking forward to it.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York. For prostate cancer treatment, results and quality of life matter. Hi, I'm Dr. Gil Lederman from Radiosurgery New York. Our enviable record includes treating thousands with prostate cancer. Critical to every man with prostate cancer and their loved ones is quality of life, urinary and sexual, and great treatment data while avoiding surgery. Treatment here is outpatient, with most insurances, Medicare, Medicaid accepted. First in America with radiosurgery for cancers from head to toe, we have the expertise to hit the cancer. Our fresh second opinion could change your life. for prostate cancer.